Hello everyone, this is Dr. Aman from Edu Pedia Overseas. Today I'm in Kharkiv city and I'm sitting with a freshly graduated medical student. And doctor, could you please introduce yourself?
Hello, my name is Dr. Harpreet Singh Raina and I'm from J&K state of India. And I recently graduated from university, Kharkiv National Medical University. And so today I'm here with you.
Yes, I think we made a video with you when you just arrived in Kharkiv with your sister.
It was my first year, right?
In your first year.
Yes.
So what exactly happened during that time when we didn't interview you? From first until this year, what happened? What kind of experiences were you able to collect?
Like a lot of memories, and you gain like beyond studies experiences, social experiences you gain, and proper well-being, and most of all in India, I was not prepared of doing I was unaware of MBBS itself. To me it was very new, and I didn't even know what is MBBS, and MBBS Overseas was beyond my imagination. So to be very honest, I didn't know how we met Edu Pedia Overseas, and my father just came with the catalog and said okay, because I was out of my mind, I have to go out, because I was like a pampered guy in my family. So I said okay, and we met Dr. KP Sandhu, and he was so generous, and we said okay. And I was I was not questioning anything, because for me it was very new to leave my family to go there.
So you were more bothered that you're actually leaving your family
yes,
than about the fact that maybe you're studying or not?
Yes, of course. So coming there for first year, I was homesickness was very at high level. But in the Indian community here, and we cope up with everything, every difficulties, and I'll not say the difficulty, but
challenges,
challenging
challenges.
Atmosphere, you have to cope up with that. And we continue with first year, second year, third year, and third year croc was and then fourth and fifth. It was all after second year, we said okay, now we are on a boost up way. So I said,
So what were your favorite subjects throughout your studies?
According to me, I mostly enjoyed pathomorpho, anatomy, surgery, and the forensic one was my best one.
Okay, so for the viewers now, maybe you can take a guess what specialty he wants to take. Wait, I will guess. Maybe you want to be a surgeon?
Of course.
Yes,
of course, yes.
Okay. So what is your next step? I mean, now just some days ago you graduated. Now you're planning to travel back to India.
Yes.
And what are the next steps you want to complete?
First of all, we have to clear the MCI exam. That's the most the main thing you have to do in India for your getting the license licensed doctor in India. So we'll be attending MCI online classes or offline classes, whatever that according to the COVID situations. So we'll be trying to do our best, and hope so we'll pass that exam too.
All right. And are you scared of this exam? Because I remember in the past the students were really worried about that, but now we have a lot of facilities to take the classes like before on campus, now also online. I
think that because of this COVID, everything was online, and every student have all that syllabus as a PDF file. So it's more easy now. But they are changing patterns, but I think we'll do it. It's easy, and students have much more facilities and everything they have.
And your sister, she also studied with you. You both of you graduated, yes. So your parents have now two freshly graduated doctors.
Twins graduated.
And a doctor's family.
Yes,
and now after 6 years, would you do the same? Would you choose to come here again?
Of course, whenever I'll get the time, I'll definitely come. Medicine life is very hectic life, but whenever I'll get the chance to come, I'll do visit. You guys also do visit once, who are graduating now, and that's all. Just enjoy your life, and whenever you're free, come out and enjoy.
And one more question, how many Indian students graduated with you from Kharkiv National Medical University this year?
I think overall foreign graduates were, I think, 150 or 130 around. I'm not sure about the accurate data set.
All right. Okay, then I wish you all the best, doctor.
Thank you.
I will surely interview you once again in India, and you will tell me what you have achieved and accomplished.
Of course.
Okay, thank you everyone for watching. Subscribe our channel, and bye bye.